Good morning and welcome back to Morning Express. We're glad you're watching. We'll be getting into our health conversation. World AIDS Day was marked yesterday, and that's what we'll be talking about in a short while with Edith Kimani, who has a guest in studio with us. But as we've been reporting this morning, those breaking news have also been screening on your, showing on your screen there. Mandera attack, 36 people believed to be dead. We're now joined online by a freelance journalist who, for security reasons, wants to remain anonymous. So, good morning, sir. And I guess we still don't have him online. All right, so we'll hopefully get him back and definitely get an update from the ground on what really is happening. At around 1 a.m. is when these attacks are believed to have happened, gunmen killing 36 of these people from Mandera. This just coming days after the other bus attack. We saw there 28 people that were killed. So we'll definitely keep you updated with the developments on this story, but definitely a lot has happened in terms of security. It has been a huge issue of concern in the country after the Mandera attacks, and the government coming out to say that yes, a lot is still being done, which, as we were trying to talk to the National Alliance chairman on what perhaps he may know of the government's workings exactly is happening, that has not been clear. A lot of people have called for the firing of the managers of security organs. We are yet to see if that will happen. The President in his speech did talk about heads rolling, not the first time we've had him say the same. But you'll remember that after that attack where 28 people were killed, many people wanted to get out of Mandera, especially those who were working in that particular region. Some were camped at the airstrip hoping to be airlifted back to Nairobi or other areas, and that did not happen. And of course, it will be interesting to hear what then will be said this time around. Who committed these killings, that remains unclear. I understand about 20 attackers, it is believed, are the ones that committed these atrocities in Mandera. It's about 15 kilometers from Mandera town where this happened. So I'll hand you over now to Edith Kimani. She will, of course, as well as the details emerge in the middle of our interview, continue as well to keep you up to speed, updated on the same. So do stay with us right here on KTN. So I understand we now have that freelance journalist with us. Good morning.
Good morning, good morning.
Thank you very much for joining us and talking to us. Would you please help us understand what exactly happened? What the details we have right now, very scanty, that 36 people were killed. Talk to us about what you know.
It is 36 people that have been killed last night in a place called Kamor. And the 6 people that have been killed have slept outside or working in a quarry. They are all non-Somalis, unfortunately.
Oh boy. Okay, I think we lost him. Do you still have him? Hello? Hello? I think we have lost him, but did manage to gather that yes, 36 people killed. He said that was last night. They were working in a quarry. He didn't quite get the last statement he made there, but a freelance journalist who's choosing to be anonymous for security concerns. We will try our very best to get back to him, just trying to keep you updated with the very latest and as much information as we can get from the ground. But for now, Edith Kimani, I'll hand it over to you.
To get in touch with that journalist, as you heard, and any more information which will be streaming to you as soon as we get it. But yesterday was National AIDS Day, actually International World AIDS Day, and to mark that day, a lot of events happen and a lot of stock taking does happen as well. And it emerged very clearly that sub-Saharan Africa still carries the highest burden of HIV prevalence, accounting for about 70% of the 34 million persons estimated to be living with HIV. And today in studio, I have Maureen Murenga, who is actually a person living with HIV. Thank you for joining us.
Welcome.
So Maureen, I think about 7, maybe even 10 years ago, a person in your situation would never have appeared on national television to speak about HIV and the disease. What do you think has happened in those years that has changed this situation?
I think a lot has happened in terms of how HIV is perceived and the miles in terms of addressing HIV. long time ago, when you knew our status, actually it was a death sentence. And when you knew your status, you'd be prepared for death. But now you know there is hope, and people can live with HIV and live wholesome lives. We have had quite some reduction in terms of stigma. It's not as stigmatized as it was before. You remember those days when you had billboards that had skeletons,
right.
and so it's not that bad, and we can see even bed reduction in hospital on HIV patients. They are not translating to AIDS, and there's a lot of information that has come over the years. Yeah, we are not yet there, but there's some mileage you have made in terms of stigma reduction and acceptance by the society of people living with HIV.
What do you think specifically has led to this stigma reduction? And when you say reduction in stigma, how do you quantify that?
It's quantified by the rate of acceptance. You can see nowadays we have pastor's wedding, people living with HIV.
Yeah.
It didn't happen before.
Right.
If you are HIV positive, you would not be wedded in church. We have mothers giving birth to HIV negative children, and then we have discordant couples getting married. One is HIV negative, the other is positive. So it's about the information that has gone around, and it's about people knowing that HIV really cannot be transmitted through the means we feared, like association and maybe taking food from the same plate like we thought before.
Right.
I can also say that in terms of people living with HIV, we have also gathered the courage to be open about our HIV status, and this has also created acceptance, because when I talk about my HIV status, I'm your friend, or I'm your sister, or I'm your cousin, so it brings the reality back home. Then everyone was dying of either malaria or TB or anything, but no one actually identified with HIV.
Right.
Yeah.
So obviously, as a person living with HIV, this is very personal for you. What incentivized you to sort of come out and start speaking about the disease openly, and your status as well? Because not everybody today is able to do that.
Yeah. What incentivized me is the rate at which, personally, I was hurting. You know, like, I had this big secret and I didn't know when to let it out, you know.
Okay, so how long had you been living with HIV before you decided to tell people around you?
I had it like for about 5 years, so you can imagine 5 years of keeping a secret. And I first tested the waters with my family, and when they accepted me, I thought, so this can work. And then later I disclosed to my employer, hoping to be sacked.
Hoping to be sacked.
Yeah, of course. I knew, let me just tell her, because I used to take time off to go to hospital, and she used to wonder why every month I had to take time off. So I decided just to tell her so that she knows, in case she doesn't want to have me anymore, then she can sack me. I was actually working in church then, but she didn't sack me. So I realized, the community can actually accept people. And then I started experiencing a lot of misinformation people were having about HIV. And during that time, I would correct someone, and then I would tell them, even me, I have HIV, and that's not true about us.
Would people get shocked, or would they be like, oh, okay?
Of course, yeah, they would get shocked, and some would say, I'm just talking about it for the sake of it, but few people would believe that I was actually HIV positive because I didn't look sick or something. They related HIV to people who are sick, who are dying, and that's how we felt when we knew our status in the time. I actually left my work before being sacked because I thought they would finally find out I'm HIV positive and they would sack me.
Okay, so let's give this a timeline. How long ago are we speaking?
About 13 years ago. Yeah, we're speaking about 13 years ago. So when I knew my status, I knew finally these people may get to know and sack me. So I walked myself out of work. And then later, when I was not dying, like I thought I would, I decided to start looking for a job again.
Right.
Yeah, but during that time, there was no hope. There was no treatment.
When you say, okay, so you're saying there was no hope, it looked like a very bleak situation for you. You were preparing for the worst, as you mentioned. Okay, so you start looking for a job again because you realize, hey, I can move on with my life.
And I need to pay my bills.
Did you experience any stigma while you were looking for a job? I know sometimes prospective employers ask for medical examinations.
I was actually looking for organizations that are not asking for medical examinations because I didn't want to be examined.
And how did you work around that?
You would know, because they would tell you after an interview that we need you to go for a medical exam, and that's when I would disappear just in the woods. I would just say, no, I'm not interested in the job anymore. until now. I went to work in church. They knew me because I used to be a member of that church, so they didn't do much, would we say, interview or background check or stuff like that. But it was such a burden because I used to think one day she may know, because somehow things get known. But
Right.
When I realized there was so much misinformation, there was so much stigma around it, and we were being mistreated actually in hospitals by the healthcare providers. So being an outspoken person, I started speaking about issues, and that is how I came to speak in the public and even talk about my status.
Okay, let's talk about two things that you've brought up: misinformation and that mistreatment that you're talking about from hospitals. When you say people were misinformed, what specific things were they wrong about? And are they still wrong about those things today?
Yeah, a few people are wrong about them. You know, like, I remember there's a day I went out for coffee with a friend, an old friend, he's a man. And someone actually sent him text and told him, I've seen you sitting with Maureen. Do you know she's HIV positive? So just by sitting with someone, you know, people thought you were dangerous. I had a baby that nannies would not change his diapers, you know, like,
Oh no.
yeah, they thought this is a HIV positive woman's baby and we don't need to take care of him. And some would even like walk out when they realize I take my ARVs and they realize these are actually medicine for HIV. They would walk out of my house. And it went out in the neighborhood, and at some point people were asking their kids not to play with mine, and it was just getting bad. And I decided, no, I have to say something. I have to tell people what HIV is all about and what can and what cannot spread HIV. They have to know the facts, the modes of transmission.
Okay.
We have to be treated better, because I thought we are equal human beings, you know, we are not like monsters. And people have to get away from relating HIV to promiscuity. It's not everyone who gets it that is promiscuous.
Yeah. You've actually just preempted, because I was going to ask, would people imagine that it's because of promiscuity that you got the disease? And how do you even get into that conversation? Because it's already coming from such an uncomfortable place.
I know, and it starts with when you're being tested and someone asks you, so how many sexual partners do you have? You know, when the test becomes positive, they think, okay, first question, the counselor asks you, is the number of sexual partners? And you go like, oh no. Yeah, it's probably one.
And so, going back to your story, because now the timeline is all over the place, but that's okay. You're speaking about misinformation, and this sounds like things we were being taught about 10 years ago.
Yeah.
Are people still misinformed in 2014?
Yes. People are still misinformed. Right from the medical practitioners, the nurses, we have the hospital staff like the watchmen and cleaners, and then community, the neighbors and stuff. People are still misinformed. There are people who quite have information, but there are people who don't. And we have a lot of, especially women living with HIV, being forced to go through tubal ligation because they are HIV positive. So they are being denied an opportunity to be mothers.
Yeah, and to build families.
And to build families, which is a right. We all want to be mothers at some point.
Let's explore this issue about hospital staff being misinformed, because you would imagine that's where the lesson begins.
Exactly.
And so what sort of misinformation have you experienced? And you did speak earlier of mistreatment.
Mistreatment.
Yeah, in hospital facilities, in medical facilities.
Yeah, the first misinformation I got is that way back, I was asked to, when I had my first son in 2003, I was told, now that you're HIV positive, you need to undergo tubal ligation, because that is what will make you stay healthy to be able to raise your son. That was not the right information. And because I refused to do it, I was going to be denied a lot of services that other people were getting who had agreed to comply to that. So I felt that was coercion, because women living with HIV have a right to choice. And besides that, we've had like nurses blaming you for failing to maybe go for your appointment on time, because they tell you it's about your life. You have HIV, you know, like they treat you like they're blaming you for having the HIV. So the kind of language they use on people living with HIV is, and then like mothers are told, we are like pregnant mothers when they are going through the program, PMTCT program, to prevent infection to their babies. They are given stuff like we are just helping that kid, you're being treated as a weapon of mass destruction. Yeah, so they look at your body like weapon of mass destruction. Your breast milk is a weapon of mass destruction, and they make you feel like you're actually a weapon of mass destruction. So it's not fair, and the violence is more on women than men, because we've not had men being vasectomized because they are HIV positive, but we've had a lot of women being coerced or forced into getting sterilization because they are HIV positive. Okay, is this then telling of why women, seeing as they have very little voice in this, account for most of the infections of HIV persons in Kenya compared to men? Yeah, there are a lot of things that actually contribute to HIV infections being more among women than men. Part of it are the biological reasons we know about, and also the environments, how we are treated by the society. Because if today
access to healthcare,
if today thugs came into this room, chances that we would be raped is higher than men being sodomized. So chances of women just facing violence because something is happening, or politics has not gone right, or the environment is not very friendly, that is high. And then secondly, there's minimal access to services by women, and therefore you find that some of those people who have gone through gender-based violence may not get prevention services and end up being HIV positive. And then third, of course, we are not in control of our sexuality. Recently, the parliamentarians passed a bill on polygamy, and so they can have as many, men can have as many women. They didn't say women can marry many men, but they say it's the other way around.
You're not welcome.
Yeah, so so again, this brings risk of HIV to the woman in marriage or at home, because if maybe the husband has like 3-4 wives, and maybe they haven't taken a HIV test, looking at our statistics, chances that one of them would be HIV infected are actually there. And this could mean that the other 4 also would get infected.
Okay. Let's talk about children, because you did mention having a son and him having to face stigma, unfortunately, from misinformed persons. How do you deal with that? Are we doing enough to teach our children about HIV and AIDS, particularly those ones who are living with it, or those who are living with parents who are infected with HIV?
One thing I must say that we haven't done much is about children living with HIV. Very little has been done, and that is because initially it was thought they would die at the age of 5.
Right.
And now we see them growing into adults. But many parents, I'll tell you for sure, have a problem disclosing to their children who are infected that they're actually infected. So they will tell them stuff like, you have asthma,
you have
chest infection. Yeah, because the children would ask, why am I taking these drugs every day? And they'll tell them, you have asthma, or you have a chest infection, or you have like, something else that is not HIV. And we are also not getting a lot of support for them in schools, because the message we have in school is that prevent HIV, don't use sharp objects, I don't know what, when you grow up, avoid sugar daddies, avoid sugar, so that kind of stuff is what they are given in school. But right there in school, we have children who actually got HIV from their parents, and this is not helping them at all. So they don't have support in school, they don't have support at home, and they are growing through this environment that is weird. And we see them reaching adolescence and failing on treatment. Actually, most adolescents are failing on treatment because that is when they find themselves, and without that support for them, then they lose it.
Okay, so in your case specifically, how did you address this concern or concerns with your son?
I developed a culture of making a close relationship with him.
How did you disclose to him, first of all, the situation in the family?
He is also living with HIV, so it was a difficult moment. But I started the conversation when he was still very naive, when he was about 6 years old. So I started talking about HIV, just giving information, and he would ask questions until we reached a point when we were talking about how mummies can pass HIV to their children. And that's when I told him that happened.
At this point, how old was he?
He was 8, yeah.
And when he found out, how did he address this with himself, and also how did his friends take it? Did they start treating him differently? Did their parents start treating him differently?
His friends did not treat him that differently because they didn't talk about it immediately. But he talked about it with his cousins and my family, and they were like, it's okay, we know, we'll take care of you, yeah, you know, we are here for you. So it was easy for him. And then as he didn't have so much questions, but as he grew, the questions become many, like why did it happen? Why didn't you do this?
Right.
Yeah, you should have done this. So even as he gets into adolescent now and he's getting to know or to find himself in the society, so he has so many questions. So I think the complexities grow as they grow older. But if the parent has the right information and he has a good support system, then he's making it. Like him, he has a good support system and I have the right information. So he's not like badly off.
Do you say?
He's not badly off.
Okay,
yeah, that's the
as we wind up the interview, let's speak about access to healthcare, because this was a big issue, particularly in the 90s and early 2000s.
Yeah.
How is that now? We've seen cases of people sort of converting this ARV into a business, selling antiretroviral drugs. What is being done with regard to that, and do you think it's enough?
About access to healthcare, I think as a country right now, if you're HIV positive, it's possible that you'll get ARVs if you're in need of ARVs. But that is all like donor funded, and the government is not doing much about procuring drugs or domestic financing for HIV.
Yeah.
But about people selling drugs, I think this is just misuse of resources and actually abuse of privileges that have been given to us. And this has been brought about by, I think, just our moral decay and I would say bad behavior. I can't say it's a lot of people doing it, but the few who are doing it are not doing something that is good.
Yeah.
Because we know as a country we have not reached everyone who needs to be reached with these services, and it would be unfair if one is registered in more than one facilities and they're able to get much more than they need, and then they're selling it. It's not fair.
Okay. Unfortunately, we have to wrap up there because of time, but I will allow you to give one message to Kenyans on anything in particular with regard to HIV and AIDS. Any message for them?
Well, I'll tell them to know their status. That's the beginning of HIV response. And I'll tell them right now we actually have a solution to end AIDS. I don't think in 15 years we should be having such discussions. We should have actually ended AIDS in Kenya. And that will begin by everyone knowing their status and mothers having babies who are not infected, so that we start raising a HIV-free generation.
Thank you very much, Maureen Murenga, person living with HIV, but obviously, as you can hear from her, her life is continuing as has been for a while now, and she intends to live for as long as possible.
Yep.
Yeah, thank you for your bravery and for your time this morning.
You're welcome.
Tumeshukuru.